COVID-19 has impacted the world on a scale we've never seen in our lifetime. Over 1 million loved ones had their lives claimed by the virus. Economies have been crashing one after the other. Millions are left jobless. Stress and anxiety are understandably at an all-time high. COVID has affected everyone's life in some shape or form. Of those affected, I would like to step into the shoes of those amidst the chaos, saving lives in the middle of a global pandemic. How has COVID impacted our health workers on the front line? How have they been able to be a symbol of hope in the darkest of times? Hi, I'm Marissa Manech, and you're listening to the Woven Experiences podcast. Here we share stories around important topics and explore the interconnectedness between ourselves and the world around us. Let's get into it. Today's guest is a trauma doctor based in the Eastern Cape, South Africa, Dr Geolain Rust. South Africa had its first confirmed COVID-19 case on the 5th of March 2020. As a country with the highest number of people afflicted with HIV, there was cause to fear the worst when COVID reached its shores. Welcome to the Woven Experiences podcast. Thank you so much for taking the time to chat with us. What were your initial thoughts when you realized the gravity of COVID-19?
The gravity was kind of thrust upon us. I don't think we expected it in South Africa. To put it this way, you always see what happens across the shores, what happens in Europe, what happens in China, what happens in the US, and you think, oh no, it'll never happen here. We'll be okay, but it'll never be that bad here. And it was. We also suffered a big blow. We had very, very sick patients. We had a lot of ill elderly patients, but a lot of young patients as well. And we lost a lot of lives. That made the gravity of the situation so much more dense. You felt that everybody is being affected by this, and everybody knew somebody who had COVID or had suffered symptoms of it, somebody who had known someone who had lost someone. You can think about this quickly on the palm of your hand, count. I knew this person. And it wasn't just because we worked in a medical field and we were bombarded by it, but people in everyday life. Everybody knew somebody who had a contact or suffered from COVID. I think the gravity of the situation was made so much more dense because everyone was touched.
COVID-19 has become really personal, as you've said. So how did your colleagues react?
Well, the colleagues, it depends on the speciality, but nobody really reacted any strangely. In South Africa, I would say we are, and I say this in inverted commas, fortunate enough to have been through an HIV build-up and wave. We've been through a TB build-up and wave. And we are used to treating patients with diseases. It's nothing new to us. We knew that it was a fast spreader and we needed to take extra precautions. But everybody knew that it's another virus that we need to take care of, be on the lookout for in asymptomatic patients. And it didn't really change the outlook of me or my colleagues on work. Work was still work, patients were still patients, and you treated everyone like you would before. COVID was just one of the differential diagnoses that now became a permanent on your tick list.
Well, with that type of experience and mindset, how quickly were you equipped, prepped, and ready when the virus actually started spreading?
I work in a private setting, so in the private hospitals, they were on top of this from the get-go. Much impressed by how they reacted to it. We were settled and going, I would think, from the time of lockdown, but also they were open-minded about it, and they were interested enough to hear from both sides what everyone thinks would work. That includes management, hospital management, nurses, doctors. the cleaners, the hospitality staff, and then also the patients. So we were quite set up and ready really early to take it on.
Wow, talk about teamwork. So you guys were prepped and ready. You've had the experience from previous diseases, but what actually went through your mind when the day arrived, the day you got your first COVID patient?
Initially, when all of this started, being in a port town, we got a lot of people who have been on ships, traveled around the world. They work on freight containers. Initially, the first few guys that come off the ships, you're like, oh, where have you been? Okay, let's start. Where did your boat take off? Where did you stop? Every port. And then if they got anywhere close to Asia or the Asia Pacific area, everybody's hair stood on end, because now you're working possibly with a suspected COVID contact patient. I think my first contact or my first exposure to a COVID patient, it was nothing different from anybody who came in with severe respiratory symptoms. You just took the extra precautions by washing your hands, wearing your mask. We had gowns and overalls that we used to wear on top of when you see COVID patients. And it it's a talking point. You go home and you say, oh yeah, saw my first COVID patient. But afterwards, it became just like any other patient. It's now almost like, oh, it's a COVID patient. Okay. It didn't take long for us to adjust to, okay, this is a new disease modality. This is a new process to follow. But we did it quite quickly, I think. I think we learned on the job very well.
South African President Cyril Ramaphosa announced a 21-day national lockdown that was implemented from the 26th of March to the 16th of April in an attempt to slow the spread of the virus. The lockdown included a ban from purchasing alcohol and cigarettes. How did this affect the rate of patients coming into the hospital?
So there was an evident drop in trauma cases, trauma related to motor vehicle accidents, intoxications, things like that. So there was a lot of that fell away. We saw only the most severely ill patients of whatever cause, including COVID. And some nights, our night shifts were quiet to the point where you wouldn't see many patients. And that was odd. It was difficult to adjust to a slower rate of work. The pace is sometimes just too slow. But we have had other nights again where, despite it being lockdown, the doctor was busy. I think we saw with the lockdown a peak in cases concentrated on COVID because those were the only ones that actually got out of bed to come to hospital. There was a bit of a sense of fear of patients coming to hospital for anything other than COVID because they were scared they would get it and pick it up at the hospital. So that did impact us quite a bit, and it took a while for us to get used to not being so busy.
And how did it affect your daily routine compared to before COVID spread?
That it didn't change much. You still go into the hospital, you see your patients. The only thing that changed was your donning and doffing, so your dressing and undressing for COVID specific patients. So if you were you were going to see a suspected case or somebody who had tested positive for whatever reason and had presented to the ER, the donning and doffing became something that you needed to get used to and do quickly so that you can see the patient. That wasn't, however, something completely new. Most doctors have assisted in theatre, and the dress up and the donning and doffing is more or less the same. You put on your gloves, you put on your gown, you put on your mask, you have your head covered, you have your booties on, and then you have your shield. And then when you take it all off, you do it in a certain procedure to decontaminate and undress in a similar fashion. So that wasn't completely new. It was just a tad annoying at the beginning to know you had to do it for every patient.
And did COVID-19 affect you personally, health-wise or mental health-wise?
I don't think I personally struggled with it. I was I was blessed enough to, that I know of, have ever suffered from it. So if I did have it, I didn't know. That, I think, made it easier. A lot of my colleagues, male colleagues more, surprisingly, it's just something that I noted, did contract the virus and did suffer from it quite significantly. Some of them were quite ill. And sometimes the things that the people said just made you think. You are suffering from a virus that is causing you to be sick and to have to stay at home, but you are so tired from the virus infection that walking to the bathroom is effort. And that is for fit, young medical doctors who work in a trauma and run on adrenaline. For them to say walking to the bathroom was effort makes you think about how severe these infections were. And for me, I was lucky enough that I didn't have to self-isolate at any time. I didn't have symptoms, and I, as far as to my knowledge, never contracted it.
Well, that's very fortunate. Now, with a lot of your colleagues getting infected and being hospitalized themselves, and with the influx of patients being relatively unpredictable, how did you cope?
The 12-hour shifts became quite daunting. We work on quite a fast pace when COVID had eventually picked up to the point where hospitals were full and patients needed assistance more quickly. Sicker patients came in. Coping for me would be, there's a balance to it. You need to experience everything for yourself and not just rely on what other people have said. Just because one person was tired from COVID, the next one might not be. So you needed to be there to understand what the patients were going through. Talking to the patients helped a lot. They felt, even though we were dressed up and looked like little minions going to Mars, if you could at least, even if it was with a gloved hand, hold their hand, it made your day better and their day better, because they needed to know that you were human. And I needed to know that they were also human. They're a patient with a virus, but they're still a person. And they needed to look at me the same as, oh, this is a, duckling dressed up with, duck mask and gloves and looks all foreign. But she's a person and she cares about me and we're going to get through this together. So for me to cope, I kind of told the patients that me and them as a team, we're going to get through it. So that was the first thing. You needed to build some humanity into it, into the sterile setting, and that helped coping. The other thing was to debrief. When we had a very, very sick COVID patient who later in the ward maybe had a negative turn or had a really poor prognosis, and finding out that you had done everything you could, but it didn't make any difference, that helped. That helped that you could talk to the team who was there that day, the nurses, and say, do you remember, what we did and what we said? And to debrief to people who understand was a lot easier, to kind of offload your personal feelings, or just to get your thoughts of the day in a logical order for you to process it. That was important. So bringing in a human contact and talking about it and how it affects you and what upset you or what you didn't like seeing when a patient arrived made it easier.
Well, having to deal with so much whilst in the middle of a lockdown, you guys probably got really close. Well, how did your co-workers cope?
So some of the people found it really difficult when lockdown came in, because now you have COVID at work and you are designated to your house at home. You can't go out. So that played a bit on minds to kind of grasp at any type of quote unquote freedom that they could get. So a lot of people, I don't know, maybe our colleagues were a bit different, but we started sending like recipes to each other, like try this pasta recipe and try this bread and you should make borscht like this. It was trying to bring in a sense of normality between us and not talk about COVID, but something like food made it a lot better. And then some other people found it really inspiring for them to start something completely different. Some people learned, I know one of the nursing staff members, she learned how to crochet in lockdown. And one of the other guys had started a meditation course. And somebody else, I had like art projects that I was doing at home on my days off. So you had to keep yourself busy outside of COVID as well, despite being confined to your house.
Yeah, no, I could relate. I've lost count on the amounts of banana breads I've baked. But now, what challenges did you actually have to deal with on a daily basis?
That's difficult. The challenges are they seem minor now, looking back on them, and you think, oh, why did I even complain? So some of the challenges were just the logistics of it all,
Mm.
trying to help someone understand that you are not treating them differently in any sense of the word because they have COVID, and trying to explain to someone else that doesn't have COVID that the risk, you can't calculate the risk for them. You can't tell them what is their risk of getting COVID in hospital, but they still need to be admitted for something else. So that was a bit difficult. Initially, when we started splitting the patients into clean and COVID areas, the the thought of some people was, oh, you're treating me differently because of COVID, which was a bit difficult to handle because to us, everyone is just a patient. You just happen to have COVID. So some people were quite difficult in terms of that, having to understand they needed to be seen in the outside field hospital rather than the main building. But people, I think, for the positive side, learned that doctors and nurses at hospitals are also human, and we needed to do everything together to help this work out.
Now, staying with the positive, what good has come from this?
For an ER doctor, and it might sound sarcastic to people, but patients realized what an ER is really for. They realized what is a red flag emergency. I need to go and see a doctor right now, rather than coming in for abnormal things that have been there for months and months, and now you just need to see a doctor because it's too painful. So I think one good thing was people understood what is the purpose of an ER,
Mm.
which was really good. The other positive was the whole dynamic of the team that you work with changed. The unit managers needed to be more involved in individual patient care. You needed your resuscitation team stopped going from 6 people with no masks to 3 people who all have masks,
Mm.
but they needed to work out a new process, a new protocol to follow, and to know that they can do this with half the people on the floor. So team dynamics change. And I think the way that things were structured at my hospital, the doctor nurses and nurses doctor team dynamics was wonderful. We learned so much more about each other because teams had to stick together. So teams didn't split up and they didn't work across team borders. So the team had to stick together. They had to make sure everybody else is on par with them and they are pulling each other's weight.
Well, I can't believe that people had to be reminded what an emergency room was for. South Africa was predicted to be COVID's playground with its densely populated townships, communal
Mm.
washing spaces, and many people living with the HIV. Despite all of this, South Africa's rates have been far lower than was predicted. Why do you think South Africa has fared better than places like the UK?
We have done really well, I think, as a country. There will always be things that need to be ironed out in any
Mm.
system. It doesn't matter if it's the first world country, the US or the UK, or a third world country like us or Brazil. We did really well. I think we can safely say that. However, we did lose a lot of lives, but you can't really say that you can't measure it on that. I feel you can't measure it just on how many deaths we had. You need to look at the recoveries as well, and the good stories that came out of it. How many babies were born during a COVID time that never contracted it, whose mom and everyone was ill but they weren't. We did really well. How we did that well is the question, and I don't think we know that yet. Places like Kenya, for example, have done so well. They have nearly eradicated it to the point where COVID is no longer a factor there. It's something that they keep in mind, but it's not a factor. The reasons behind that, like I said, I don't think we have data yet. Maybe we are more robust because we are faced with things like you mentioned, HIV, TB, we are faced with more diseases and a spread of pathology than the first world. And that made us more robust because we knew it's just another disease. We're gonna fight this just like we do TB every day and HIV every day. We're gonna get through it. So I'm not sure how to explain how come South Africa or Africa has done so much better, but I think the history of our existing pathologies amongst people, as well as the fact that a lot of our populations are already on things like HIV medication, or the fact there was an article that stated the fact that we have a government endorsed vaccine program in our kids is the reason why us and Italy and Brazil, not Italy, well, I can't remember the other country, up in Africa did so well because of this. So it shows that some of the systems that Africa has in place could be a model for the world to base it on, to see if anything would improve in the future.
No, for sure. I actually read in a BBC article, I think it was written by Andrew Harding, where Professor Salim Karim and Professor Sabir Mahdi share their disbelief at how well South Africa is doing. Professor Mahdi was quoted saying, "This is an enigma. It's completely unbelievable." Yes. In the article, they actually give a lot of credit to South Africa's young population. I think the average age of South Africans are actually half of European countries.
Yeah, that is definitely possible.
Now, we've spoken about quite a few things, but what do you hope listeners actually take away from this?
There's a couple of things that have come out from COVID that I think we can all learn from, and it's not just from a medical point of view. I think I'll probably break it down to maybe 3 or 5 points. The first is that COVID is a new virus that has come and it is taken on the world. So there's no one in particular that has been spared. And in that sense, it makes us all equal. Terribly put, but a virus has equalized the world and shown us that everybody is actually, down to the last cell and the last anatomy, the same. And in the same breath, the world has come out on the other side. We have lost many, but we'll learn from that. The second thing is to not, on the basis of COVID, further discriminate against someone. Just because they had COVID, they didn't ask for it. They didn't go looking for it necessarily. And it's not really your place to judge once they have been diagnosed with COVID, how they got it, why didn't they do this, why didn't they do that. It's difficult. Some people go through the whole COVID pandemic in and out of parties and never get it. So on that part, don't discriminate because we are so different.
Yeah.
And then the third part was that we need to help each other. You could obviously see all the cases where young people were starting to deliver food to the elderly who were stuck in their homes, people who had lost their homes because of the economic crisis, that people actually stood up and helped each other. How many times did communities in flats not come together and one sings a song, one plays the guitar, one dances and claps, and everybody has fun for the evening? It's brought us together way more than it has, I feel, torn us apart, irrespective of whether you agree with how it was managed or should be managed or should have done this or should have done that. It's brought us all together and it's equalized us in a place where we can all say that we're exactly the same as the other person, and we need to cherish that. You're not better or worse, and I think that's what COVID has shown us.
Yeah, no, for sure. And I do believe that despite social distancing, communities actually have come together to support each other. Thank you again for taking the time to chat and give us a peek into how it is on the front line of COVID. And a huge thank you to all the health workers out there who don't only save lives, but treat their patients with compassion and dignity. We're all human, after all. And that's a wrap. Thank you so much for tuning in to today's episode, and be sure to subscribe to this podcast to avoid missing out on any future episodes. I'd appreciate it if you could leave a review, And if you have any thoughts on today's episode or perhaps topics you would like me to touch on, you can contact me via email. A link is provided in the description. I hope today's episode provided some new insights to what it means to be human. And I hope to see you in the next one.